My name is Andrew Kenworthy. I'm the Chief Executive for South East London, and today I wanted to talk to you in the second of my infamous videos about the importance of the QIPP agenda facing the NHS, particularly in our part of London. QIPP, as we all know, stands for Quality, Innovation, Productivity and Prevention, and it's essentially the NHS's way of improving the value for money offered by our services, whilst at the same time continuing to improve the quality and clinical outcomes which are received by patients. You only have to look in the newspapers or on the news or look at any of the other internet media to realise that resources going forward are going to be really tight, and therefore it's really important that every one of us in our healthcare organisations across the whole of South East London really pay a real close attention to how we maximise the resources we have.
My name's Mark Chamley. I'm a GP in Lambeth. I'm also the clinical lead of the Lambeth diabetes team. So in terms of diabetes, we work with all 52 general practices in Lambeth. I work with the Lambeth Diabetes Intermediate Care Team, which consists of myself, a team of diabetes specialist nurses who work in the community, and also a part-time consultant diabetologist from St Thomas's Hospital and a dietitian. Broadly speaking, the team has three main aims. Firstly, it's very much about working with people who have diabetes so that they can manage their own diabetes better. We know that most of the care people with diabetes get is care they give to themselves, so it's important that people with diabetes have the skills and knowledge to do that. One way that we help patients to self-manage their diabetes is by running a program called Desmond, which is a structured education program for people with type 2 diabetes. The second important function of my team is very much about helping general practices to manage diabetes better. We know that there is variation in the quality of diabetes care provided in general practice, with some practices in Lambeth delivering really excellent care, but some practices delivering less good care. Practices which deliver less good care often have GPs and practice nurses who haven't had much diabetes education. So one of the roles of my team is to deliver that. Another way in which we deliver education in practices is by running something that we call virtual clinics. So these occur in Lambeth practices 4 times a year and are a round-the-table discussion with the practice, looking and talking about their diabetes patients so that they get advice about how to manage them better. We also run education programs locally. For example, we run a course on insulin management for GPs and practice nurses, and we also run a course for administrators who run the recall system in practices to ensure that patients are seen regularly. A third part of what we do is providing specialist diabetes care in the community. So practices can refer to us and we can provide specialist advice to their patients. And we run 2 community diabetes clinics per week at Graceful Gardens at Streatham and at Springfield Health Centre in Stockwell. And practices can refer patients along. It's a non-tariff service, so it doesn't incur an outpatient cost. And also we think it's more convenient for the patient because the patients are seen in the community in an environment which is hopefully less stressful than going to the hospital, and is also hopefully nearer to where they live.
So the QIPP isn't about a penny pinching process of trying to determine how we save the next pound. It is very much about how we manage and deliver the most effective care we can given the resources we have. We have a new operating plan, and the operating plan for the NHS sets out our financial assumptions over the next few years and sets out what we need to deliver. And it doesn't take me to tell you the financial position in the NHS and every other public service is going to be really tight, and therefore we need some really robust plans to think about how we move forward. The mechanism by which we do that on a local basis is called our commissioning strategy plan, and this sets out our programme over the next 3 years about the kind of productivity programmes we're going to develop, both at a local and at a cluster level. And there are 4 main themes which are central to our commissioning strategy plan. They are productive care, so making sure that we're commissioning services which represent really the most effective way of delivering, making sure that we're prescribing the right drugs, making sure that we have joined up care in terms of making sure people are able to stay at home rather than to go into hospital, really driving out the most effective and productive way of delivering the care that we're responsible for.
We all recognise in primary care that it's important that we use resources sensibly, and when we come to referring patients to hospital, that we do that when there is a real clinical need for that to happen. And one thing that my team provides is I suppose an alternative to referring patients to a hospital setting. And we do this in a number of ways. We run in each practice 4 virtual diabetes clinics a year, and during those clinics, which involve the practice team and a diabetes nurse and a diabetes consultant, we talk about patients and give the practices advice about how to manage those patients without the need to refer them to hospital. Another way that we help practices to refer more appropriately is by providing education and training, because if GPs and practice nurses are upskilled in diabetes, they're able to manage more complicated patients and therefore need to refer less often, or when they do refer, those referrals really need to be made.
The next major theme is around staying healthy. So it's enabling people to make choices about their own health. It's about continuing to tackle those causes of ill health such as smoking, alcohol, drug misuse, which potentially have a massive impact not only upon the individuals themselves but also on society as a whole. It's about integration, so that rather than focusing on a range of conditions, that we actually focus on individuals and look at what are the kind of care packages we offer for individuals and think of them in a holistic way. And the final area is we talk about those areas such as NHS London priorities, those things that we need to operate on a much bigger scale than both South East London and the clinical commissioning groups. Areas like integrated cancer systems, so there is the same level and quality of all levels of cancer services irrespective of where you are in that system. One of the things I want to do in terms of the QIPP programme is really to step up what it is that we're doing. That this isn't a passive process, that we really need to make sure that every part of our system, that every part of our organisation and every individual is focused not only about how we improve quality, but how we do that more efficiently. And so that relates to everyone in our organisation. It relates to the number of pencils we order, the amount of stationery we order. It relates to are there more innovative ways of communicating rather than travelling on trains or moving around. But equally, it relates to making sure that our organisation are really focused on the things that make the biggest difference. It's about creating powerful coalitions. Now, powerful coalitions is about getting the right people around the table. And often those right people will be people like the chief executives from local authorities, they will be the chief executives from trusts, they will be the chief execs of social enterprise in the third sector, to make sure that we look as a system at how we really drive out costs. It's about creating a vision, and the vision for South London is, South East London, is better for all. So this is about making sure that it's better for patients, better for staff, better for organisations, because we are working together to really focus on how we can be the best.